Good afternoon. How's everyone doing? Y'all have to forgive me. I'm used to walking around a lot when I speak, but I'll try to be still today so I can stay close to the microphone. But as Clinton mentioned, I've been here for about 2.5 years. I started on Halloween of 2016 and have really enjoyed every minute of it. This is a wonderful community, both professionally and personally. I've been married to my wife Lisa for close to 13 years, and we have 3 children. So just a lot going on at home, and just a great area for them, and certainly a great place to work. So thrilled to be here. Really overwhelmed at this turnout. This is a fantastic turnout, and I think I've got about 35 minutes with you. So I'll give you maybe 25 minutes of information, and then we can have some time for questions and answers at the end. So Clinton asked me to speak about our transition to Prisma Health, which I'm excited to do, and I think in order to gain an appreciation for that transition and where we are now, we need to take a quick peek back at where we started, what our journey has looked like in those years, and how industry challenges and changes have kind of shaped our direction. And now that we've transitioned to Prisma Health, how are we positioned to continue to serve our local community? And then I've just got a couple really brief closing thoughts, and again we'll wrap it up with questions and answers. So it all started back in 1947. Johnny Roper met with a group of local businessmen in the Pecan Terrace Hotel in Easley, and they pitched the idea for a hospital here. And they were serious about it. They left that meeting with about $50,000 in seed money, which today would be a really special gift, but in 1947 that was just quite remarkable. And Sarah Hamilton Meese caught wind of that, and she donated the 10 acres of land that this hospital currently sits on. And so obviously that was a key contribution to this becoming a reality. And then over the next 11 years, it was just really a community effort. The workers from local mills donated a day's wage to help make this possible. The State Baptist Health Association stepped in and helped us finish this project. And after a lot of blood, sweat, and tears, in July of 1958, the doors opened. And so just a really, to me, I think that goes a little bit underappreciated in the fact that this hospital was built during a time where a lot of community hospitals were using Hill-Burton monies and government funds to bring those out of the ground, and ours was really all locally driven, and I just think that's really special. And so our community hospital has seen a lot of the same changes that other community hospitals have seen over the years. We've added an emergency department. Our imaging equipment has changed dramatically over the years, and we've tried to keep up with that rapid pace of change. We've constructed an operating room, built a birthing center. We have, over the last 15 or so years, you've seen a tremendous uptick in physician practice acquisition as reimbursement models have shifted and really driven a lot of that activity. And so we've our story's been fairly similar to other community hospitals. And about 10 years ago, ushered in a significant change for this organization, and that was the first time that the Greenville Health System and Palmetto Health came together. And when they came together, that was a joint venture that created Baptist Easley Hospital that existed until October of this past year. And so this was a really important time for us. This joint venture served us well over the past decade. Our relationship with Palmetto Health was really defined by corporate support, so we leaned on them heavily for IT services, legal services, human resources, corporate compliance, all of those types of things that you have to have, but are harder to have as an independent community hospital. We had access to a deeper bench of expertise, if you will, in all of those areas. And our partnership with the Greenville Health System was defined much more clinically. Even before we transitioned, we already had GHS pathologists and anesthesiologists Our emergency department was staffed with GHS physicians. Our hospitalists, which are the physicians that you see when you're an inpatient here, were GHS physicians. And so we already had a really strong partnership with them in that way. And again, I say that it served us well this past decade, and it was a decade of really unprecedented change in healthcare and unprecedented challenges. And with payment models shifting, reimbursements decreasing, regulations changing continuously, growing continuously, it became really hard for independent hospitals not connected to a larger system to be viable. And you see that today more so than ever. This was a 3-minute Google search yesterday, and that's Oklahoma hospital misses payroll for the 3rd time this year. Healthcare deserts growing in North Carolina, and what that means is in very rural communities, and obviously Easley's not as rural as some, but there are folks that are 100 miles away from an emergency room. And that's a big problem that we're going to have to address as we continue to see these hospital closures. Another hospital in North Carolina that can't make payroll. And right here in South Carolina, Community Health System sells 4 hospitals. So just a ton of this activity. And it's not isolated to community hospitals either. The story's a little different, but you're seeing a huge impact with larger tertiary teaching facilities as well. And that's really been defined by merger and acquisition activity. And again, that's close to home too. If you look right here, Atrium Health is what was Carolina's health system, headquartered out of Charlotte, and they just combined with a health system in Georgia. Bon Secours, which owns St. Francis right here in Greenville, has merged with Mercy Health. And so you're just seeing this all over the place. And what's really driving this is how the necessity to have size and scope. You really got to be able to scale up to be competitive in today's healthcare market. And while Greenville Health System and Palmetto Health were both large employers and large providers, and the scale of where healthcare is going, they both needed to grow. And so Greenville Health System and Palmetto Health formed Prisma Health in January of 2019. And obviously, we came along with that. So we were excited about that. It's just a really neat time in the life of our organization and in every organization that's a part of Prisma Health. And right now it is run by co-CEOs, Mike Reardon, who was formerly the CEO of Greenville Health System, and Chuck Beeman, who was formerly the CEO of Palmetto Health, are responsible for Prisma Health. And there are 2 affiliates of that company right now, Prisma Health Upstate, which was formerly Greenville Health System, and Prisma Health Midlands, which was formerly Palmetto Health. And Dr. Spence Taylor is the leader of Prisma Health Upstate. He's a vascular surgeon by trade, was very integral in starting the medical school on the Greenville campus, has been at Greenville for decades, and just a tremendous advocate of healthcare in the upstate, and just a really great leader who we're very lucky to have. So what's the big idea behind Prisma Health? Well, we want to make South Carolina healthier. And we've got some opportunity to do that, because right now we rank 44th in the nation for health. And some of the key drivers of that, in the past 5 years, the number of children living in poverty has increased 28%. We're ranked 47th in the country for low birth weight. We're ranked 43rd in the country for both diabetes and smoking, and 47th for high cholesterol. And so if you're looking for a silver lining, the only way we can go is up, so that's good. But we want to start to impact that, and we feel a responsibility to help impact that. And so that's part of the big idea behind Prisma Health. And in order to have an impact on a large population, you have to be able to touch a large population. And combined, we serve nearly half of South Carolina. And so you see the shaded areas on these graphs, and the blue shaded areas are served by the Midlands, and obviously the green by the Upstate. But what's also interesting on this slide, you see all the different colored dots. And a majority of those, they all represent different hospitals, and a majority of those dots represent hospitals that belong to a larger system. And in every case except Prisma Health, that system is not headquartered in South Carolina. And so I think that's a key differentiator for us. It was announced probably about a month ago that Prisma Health's headquarters will be in Greenville. And so you're looking at a $4 billion industry, the largest private employer in the state of South Carolina that's headquartered just across the river from us. So I think that's really important. But again, to affect that change, we've got to have reach. And so this enables us to do that. So 45% of South Carolina residents will live within 45 minutes of one of our 15 hospitals. So almost half the population of the state will be under an hour's drive to one of our acute care hospitals. 42% live within 15 minutes of one of our outpatient clinics. And so that's a big deal for us. And we're working to make sure 100% of our patients that we serve have access to us through various telehealth programs. So that's kind of Prisma Health at a system level, and we'll look at it at an upstate region level for just a couple of minutes. So we are structured regionally. There's 4 regions in Prisma Health Upstate, and they're 16,000 employees, 8 campuses, almost 1,800 inpatient beds, 12 specialty hospitals. Obviously, Greenville Memorial is our satellite or flagship campus. It's a 746-bed tertiary care facility that's also a teaching center. And we have more than 150 practice sites. So we have a large presence here in the upstate. And as I mentioned, we're split up into 4 regions. And we are in the western region, which consists of Anderson, Oconee, and Pickens counties. And so we have a leadership team just for western region. There's a dyad leadership model, so there's a clinical leader and an administrative leader for each region. And our clinical leader is Dr. Scott Sasser. He's our Chief Clinical Officer, and he reports directly to Spence Taylor, who is the president of Prisma Health Upstate. And I think that's important. Oftentimes when a smaller organization becomes part of a larger organization, the priorities of that smaller organization maybe aren't evaluated and shepherded as much as they need to be. But the way that Dr. Taylor has structured his leadership team, every region leader reports directly to him. And so that's an advocate for us at the highest level of this organization, someone that knows our community, that knows our hospital, knows what our needs are, what our challenges are, that has a direct line to the highest level of our organization. So I think that's really neat. Gene Ward, who is the CEO and president of Oconee Memorial Hospital for years, is our Chief Operating Officer. Pat Smith is our Chief Nursing Officer. Ben Gesowich is responsible for ambulatory operations. So what that means is for every clinic that we have in the western region, he's got administrative responsibility for that. And then Hunter Combe is my counterpart at Oconee Memorial Hospital. And we meet every Tuesday morning. I just came from that meeting. We meet from 9 to 12. We have a strategic plan for this region that we continuously track our progress to, and we really have a great team that we enjoy working with. So some of the big priorities for our region, number 1 is quality. How do we improve the quality of our care that we deliver every day? How do we learn best practices from each other? How do we serve our communities better? What are the needs in our individual communities? How do we keep more services here at home, locally? How do we collaborate across the region? How are we engaging our physicians, our staff, the community? We're very focused on that. Academic expansion and development, what does that look like? And we'll talk a little bit more about that in a minute. And obviously our financial performance. So what we've done so far, we've talked about Prisma Health at a system level. We've talked about Prisma Health Upstate, the western region of Prisma Health. And so now let's look at a little bit about how Baptist Easley shows up within that, okay? So when we were going through this transition, obviously one of the first things that was shared with the leadership team is the new purpose statement for Prisma Health. And the first time I saw it, I was incredibly drawn to it and struck by how similar it is to the mission statement that we used for Baptist Easley Hospital. And if you look here, both are rooted in compassionate service, and start with that. We are all called to serve, and we have an opportunity in this line of work to do that every day. And so I was really glad that the system, recognized the importance of that. It's about inspiration. How do we inspire those around us in a way that makes them healthier and in a way that they grow? And then finally, the last piece for us when we were Baptist Easley was personalize the experience. And that's a recognition that we are dealing with people and the human condition and all that comes with that. It's not a traditional manufacturing environment. When we have a customer that shows up, they have a different belief system, they have different comorbidities, they come from different socioeconomic backgrounds. They're just all different. And so we need to make sure that we personalize their care to them. And when you do that, you make a difference in someone's life. So our mission statement is very consistent with what the purpose statement is, and so there was a very natural transition to that for us. So how do we, knowing that we live in a community that is growing very quickly, from Powdersville to Easley to Clemson, which makes up our service area, how are we going to position ourselves to serve our community as we go forward? And so we've worked very hard on that over the last 5 to 10 years. This is Medical Center Powdersville, which houses a lot of different services for the Powdersville area. There's a MD 360 urgent care facility. There's a satellite office of Blue Ridge Orthopedics there. We have ENT services there, general surgery, just a lot of different things that are needed in that community. Radiology lab, and from an imaging standpoint, we offer just about everything right there. So that was an important step for us to help serve kind of the southern portion of our service area. And about 3 years ago, we opened Fleetwood Convenient Care right here inside of Baptist Easley Hospital. It's right at the front of the outpatient entrance. And this is somewhat like an urgent care. They see a little bit lower level of acuity, but a lot of the things that you might typically have to go wait in line for in an emergency room, we can treat you for those right inside Fleetwood Convenient Care. We saw 8,700 patients there in 2018, so it's a very busy clinic. It's staffed by 2 or 3 nurse practitioners depending on the time of year. They take insurance, and so that's been a great tool for us as we've tried to deliver the right care at the right place at the right time. And then up to Clemson, we opened Patrick Square about 2 years ago. Again, this is another multi-specialty practice. It houses a primary care practice that has 2 internal medicine physicians and a nurse practitioner. Clemson Neurology is in this location. Roger C. Peace Rehab is also there. Carolina Cardiology rotates through there a couple days a week. We offer sleep lab services there as well as imaging and lab. So a lot going on there. Again, a growing market, and we want to be there to serve that growing market. Another area that's important to us is women's services, and certainly OB. There are about 300 births in this community right now that are not captured by any GHS facility, and we want to capture those births. And so we've done a lot of work over the last 2 years around OB, and we've here there's a couple pictures of the renovations we've done to the Women's Center. We've got all new birthing rooms. We've remodeled and renovated a lot of the infrastructure space up there. So the nurses station, there's a lactation room there. Just a lot of different things that we needed to do to that birthing center. So the foundation was really integral in that project and helped us get that done, as well as the Greenville Health System. And I'll tell you a little bit more in a minute about how they do that. But just a big key piece for our strategy moving forward. And then we've also recruited all 4 of these providers within the last 2 years. Dr. Aaron Eckert joined us this January. Dr. Hufford joined us last August, and then Dr. Ridley and Brittany Hall, who's a certified nurse midwife, joined us back in 2017. So just done a lot of work around that area. And I mentioned GHS and the foundation helping us with this project, and I meant to mention it on the slide when I was telling you about the joint venture, but part of what Greenville stepped up to the plate with when we formed that joint venture, they committed to $4.8 million in capital investment in our organization over 10 years. Now, in order to capture that, our foundation had to match that. And so for every dollar that our foundation spent on capital projects over the last 10 years, Greenville Health System would match that. And so I think wisely, our foundation drew down some of the endowment to take advantage of those capital dollars, because at the end of the day, that's $1 million in capital a year that didn't have to come out of the hospital's funds. So that was a really, really big deal for us. And this is just one of the projects that was made possible through that. The Patrick Square office that I just showed you, Medical Center Powdersville, those were all made possible through that arrangement. So we're offering some new services. We started vascular surgery here a few weeks ago. Some more basic procedures, port access, declots, those types of things. But we're looking to grow some endovascular service out here as those surgeons become more comfortable with our facility and our nursing staff becomes more comfortable with them. We look forward to that expansion. 3D mammography will be on site hopefully within the next month. That's really the standard of care around breast imaging now, and so we're excited to be able to offer that. There's a new program that is expanding from Greenville to Baptist Easley in the emergency department called FAVOR, and this is a program that gives us access when we have a patient that comes in who's addicted to opioids. This FAVOR program puts them in connection with someone who can help them navigate that addiction and can get them the resources they need to try to overcome that addiction. And so first and foremost, it's important to us in that way because we can serve in a way that we currently cannot. But two, it also is a huge resource for our providers in getting those folks the help they need quickly so that they can turn their attention to medical needs in that setting. So we're excited about that. We now offer outpatient medical nutrition therapy. You saw the slides earlier around diabetes and obesity in the state, cholesterol. Those are all issues that as a state we struggle with, and a lot of those are tied back to nutrition. And so with a referral, you can seek this service, and we're very excited to offer it. We are trying to get approved to have a general surgery residency program here in Easley. Dr. Dane Smith has joined our medical staff from Greenville. He is very well known in our system. He's a fantastic surgeon with a lot of great experience. He's a senior faculty member. And his big idea is to do a general surgery residency program with a rural healthcare focus on it. And so you just saw the headline about healthcare deserts. And there are these local communities that may only have one surgeon in town. And if that's the case, you need to know a little bit about urology and OB and orthopedics, and you can't specialize. And so he's trying to reach that target audience for folks that want to serve in a community like that. So we're trying to get that approved by the accrediting body right now. Epic integration was a really big deal for us. So Epic is the name of our new electronic medical record, and it's the same exact electronic medical record that every other hospital in the upstate uses. And so what that means for you is if you have to seek care at other hospitals or from another hospital to here, your information flows seamlessly from care setting to care setting. And that's a big deal. That means everyone on your care team has access to the information they need to treat you in the most effective manner possible. That was a big change for us. It's not just an EMR, it's our billing system. It comes along with new medication cabinets, new lab equipment, a new PACS system, which is the system that archives all of our images. So just a lot of workflow changes that came along with that. And we went live with that in October. Quick update on some growth in existing services. Orthopedics is an area we've been focused on tremendously over the last couple of years. We just moved our orthopedic practice into what was the old medical center, Easley. This is a much better space for that patient population. The entrance is covered. The entrance is on grade. There's automatic door openers. The hallways are wider. Just a lot better for them. So we're excited about that. We're growing outpatient infusion services. Cardiac and pulmonary rehabilitation has exploded since we've gone live on Epic, because all those providers, when they're making referrals, now see Baptist Easley since we're on the same system. We had to get another position approved last week just to accommodate that demand. And our wound healing services, we have a wound center right here on campus on the 3rd floor of this building, and their volume is growing as well. In order to do that, I've mentioned the foundation a couple of times. They're an incredibly important partner in that, and so we want to certainly thank them and recognize them. Their annual fundraiser or signature fundraiser is coming up on May the 4th. It's their annual gala that'll be at the Madron Center. That just happens to be the same day as the Kentucky Derby this year. So if you want to put on a really big hat and bet on some horses, you can contact the foundation and they can give you more information on that. But it'll be a lot of fun, a good live auction and silent auction there. And we raised almost $90,000 there last year. So, Prisma Health Upstate and Baptist Easley, in my opinion, have always been really good corporate citizens, thanks in large part to folks like Clinton and his team in the Community Relations Office. And so it's important to us to be connected and ingrained in this community. And so I want to just go through a few partnerships that we have. The first is our Project Search group, and that's a partnership with the School District of Pickens County. And the big idea around this is to identify folks with intellectual disabilities that just need opportunities. And so if you look at that population, the unemployment rate for them is over 70%. And so we started this program in 2016, and the school district helps us identify students that are finishing up high school, and they go through an interview process here at Baptist Easley, and we sponsor a number of different internships for them. So they work in our environmental services area, food and nutrition, supplies, just a lot of different areas in the hospital. And we're about to graduate our 3rd class in May, and that would be a total of 20 interns, and the employment rate for these graduates is over 95%. And so we're having a great time with them. We're obviously honored to be a part of that, and glad to see them doing so well. Access Health Mountain Lakes, this is a program that's partially funded by the Duke Endowment, and you can think about it a little bit like a case management program. They identify at-risk individuals in the community that maybe show up to the emergency room all the time because they don't have a primary care provider, whatever the case may be, and they connect them to the resources that they need to better manage their health. And in this population, since we've started in 2013, we've served 539 patients. We've seen a 9% reduction in inpatient utilization in that patient population and a 42% reduction in emergency department utilization. And that's a big deal. That means they're getting the care in the appropriate environment. We partner with the Samaritan Health Clinic. We provide them with a significant amount of operational funding each year. The Dream Center, we donated one of the tiny houses, if you know anything about that organization, 2 years ago. And then we work with both of those organizations for the dental clinic. We have a free dental clinic here in Easley. We provided the funding for all of the equipment. The Dream Center provided the location to put all of it, and the Samaritan Clinic operates that for us. And so that's a big service for this community. We deliver Meals on Wheels every Friday afternoon. We have a partnership with the YMCA through sponsorship every year, as well as participation in their mentor program. All right, and I think I'm about out of time. I didn't take too much time, I hope not. But I do have time for questions and answers.
For your dental clinic, how do you access that?
You would access that through the Samaritan Clinic, and they would give you a referral up there.